Dozens of new vaccine appointments will become available this week under the state's rollout plan. And here to answer your questions is Dr. Daniel Kariskas, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
So Governor Baker said today he expects about 120,000 appointment slots to open up. As you know, only people 75 and older, they're eligible to book them right now. Should they check first to see which vaccine brand is being offered, or is this really you just take the first available appointment?
Just take the first vaccine offered to you. We know that the currently available vaccines are equally effective. There's really no reason to try to wait and see exactly which one you're going to get.
What about the growing concern over these new variants of the virus and how many may be circulating in the U.S. right now? Do you feel that's adding to the urgency of getting more people vaccinated? And is there a risk if we can't get that done quickly?
We really want to stop the transmission of these viruses, to stop the virus from spreading person to person, because that's when variants can emerge, and also prevent the existing variants from really gaining a major toehold in the United States. We can do that by making sure we vaccinate as many people as quickly as we can, and by insisting that everybody wear a mask.
So let's talk about a vaccine still in the trial stage. AstraZeneca releasing data suggesting that its single-dose vaccine may substantially reduce transmission of COVID-19. Would that offer a new level of protection that Moderna, Pfizer, the ones approved here, don't have?
What the AstraZeneca vaccine data showed was that people were much less likely to be PCR positive if they did a nasal swab in the vaccinated people. Then they infer from that that there was less transmission. I think it's likely we'll see similar data from the other vaccines. It's just taking more time for those trials data to get out.
Okay, so something to watch there, certainly for the future. The new CDC Director, Dr. Rochelle Walensky, said today that schools should be able to reopen safely, even if teachers have not been vaccinated. What do you think about that?
I agree. We know how we can keep students and staff safe by making sure that everybody is masked and that they're adequately distanced. Schools certainly need the support and the help in order to be able to plan and implement strategies to safeguard everybody. But there's no reason we can't go ahead with those safeguards and ensure a safe environment for all concerned in the schools.
Yeah. All right, Dr. Kariskas, thank you for your insight. As always, we really appreciate it.